a comprehensive guide to lowering your prescription drug costs. If you're finding it hard to pay for your prescription medications, you're not alone. Many Americans face high drug costs, especially if you're uninsured, underinsured, or dealing with rising copays. The good news? There are many ways to make your medications more affordable without compromising your health. In this presentation, we'll guide you through assistance programs like generics, discount cards, and government aid, with clear steps to access them. Whether you use online tools or need in-person help, we've got solutions for you. By the end, you'll have a plan to reduce your prescription costs and focus on staying healthy. One of the simplest ways to save on prescriptions is by choosing generics or therapeutic substitutes. Generics are exact copies of brand-name drugs, with the same ingredients and safety, but they cost 50 to 85% less. For example, a brand-name drug might cost $100, while its generic could be just $15. Therapeutic substitution means switching to a different drug that treats the same condition, like a lower-cost cholesterol drug instead of a brand-name one. These options keep your treatment effective but save you money. Talk to your doctor or pharmacist today to see if a generic or substitute is right for your medication. It could cut your costs significantly. If you have a low income or no insurance, patient assistance programs, or PAPs, can be a game changer. These programs, run by drug companies or charities, offer free or discounted brand name and specialty drugs for conditions like cancer or rare diseases. To qualify, your income typically needs to be around $45,180 a year for a single person in 2025, and savings like a 401k usually don't count. Visit NeedyMeds.org or RxAssist.org to find PAPs for your medications. Charities like the PAN Foundation or HealthWell Foundation help with copays or premiums, but check for waitlists, as funding can run low. Always visit these websites or call the programs to confirm the latest eligibility details, as they can change. Apply early and explore options like Accessia Health if you face a waitlist. If a patient assistance program denies your application, don't give up, you have the right to appeal. Contact the program to learn why you were denied, often due to missing documents or income verification issues. Gather additional paperwork, like updated income proof or a letter from your doctor explaining why you need the medication, and resubmit your application. Websites like NeedyMeds.org offer tips and sometimes appeal forms to guide you through the process. Each program has its own appeal steps and deadlines, so check their website or call directly for details. Persistence pays off. Appealing can help you access the free or low-cost drugs you need. For fast savings without complex forms, discount cards and non-profit pharmacies are excellent choices. Tools like GoodRx, SingleCare, ScriptSave WellRx, and Amazon Pharmacy give you up to 80% off at participating pharmacies, no matter your income or insurance. For example, a generic drug might cost $10 at one pharmacy and $25 at another. These tools find the best deal. Manufacturer coupons can cut copays for brand-name drugs like Jardiance, saving up to $175 a month, but some insurance plans use copay accumulators, meaning coupon savings don't count toward your deductible. For instance, a $100 coupon won't reduce your deductible, so you may pay more later. Check with your insurance. Non-profit pharmacies like Rx Outreach or Cuban Cost Plus Drug Company offer generics at low, transparent prices, often beating insurance copays. Check their websites for current prices, as discounts change often. Federal government programs can make a big difference in your drug costs if you qualify. Medicare's Extra Help program helps low-income Medicare beneficiaries cover Part D premiums, deductibles, and copays, with eligibility for individuals earning up to $23,475 or couples up to $31,725 in 2025. Apply at Medicare.gov and check for updated income limits, as they can change yearly. Medicaid, a federal state program, covers prescriptions for low-income people, but eligibility depends on your state's rules. Visit Medicaid.gov to confirm your state's criteria. These programs are powerful tools for reducing costs, but you'll need to verify your eligibility online or by calling, as requirements may shift. Beyond federal programs, state and veteran options can help lower your drug costs. About 20 states offer state pharmaceutical assistance programs, or SPAPs, like Pennsylvania's PACE or New Jersey's PAAD, which provide low copays of $6 to $15 for seniors or the uninsured. Eligibility varies by state, often requiring you to be 65 or older with a specific income. Check benefitscheckup.org or Medicare.gov for your state's program. Veterans or service members can access prescriptions for just $5 to $11 through VA or TRICARE, but you'll need a VA provider. Visit va.gov to confirm eligibility, as rules can differ by state or year. Always check these websites for the latest details to ensure you qualify. Even with insurance, you might hit roadblocks like prior authorization or step therapy that delay your medications. Prior authorization means your insurance needs your doctor to prove a drug's necessity, which can involve extra paperwork. Step therapy requires trying cheaper drugs before getting the prescribed one, which can cause delays or side effects, especially for conditions like diabetes. Work with your doctor to provide a medical history, including any issues with other drugs, to strengthen your case. These hurdles can be frustrating, but your doctor's office can help navigate them. Learn more at the American Medical Association's website for tips on dealing with insurance challenges. If your insurance denies coverage for a medication due to prior authorization or step therapy, you have the right to appeal. Contact your insurance provider to request an appeal form and work with your doctor to submit evidence, like a letter explaining why the prescribed drug is necessary or medical records showing other drugs didn't work. For Medicare Part D, visit Medicare.gov for appeal steps, including deadlines like 60 days to file. For other plans, check your policy or contact your state's insurance commissioner for help. Resources like NeedyMeds.org can also guide you. Appealing takes effort, but it can get you the medication you need. New policy changes are making prescriptions more affordable, especially for Medicare users. The Inflation Reduction Act of 2022 will lower costs by allowing Medicare to negotiate prices for high-cost drugs like Eliquis and Jardiance, starting in 2026. More drugs will be added in 2027, potentially reducing your out-of-pocket expenses. These changes are a big step forward, but they depend on your plan's formulary, which lists covered drugs. Check your Medicare Part D plan's formulary on Medicare.gov or with your provider to stay updated on these savings. This is a great opportunity to plan ahead for lower costs. Ready to save on your prescriptions? Start by talking to your doctor or pharmacist. They can suggest generics, substitutes, or patient assistance programs for your medications. Use online tools like NeedyMeds.org or RxAssist.org for PAPs, or GoodRx.com and SingleCare.com to compare prices. Nonprofit pharmacies like Rx Outreach or Cost Plus Drugs offer low-cost options. Check these websites for the latest eligibility and pricing, as details change often. Gather documents like tax returns or prescriptions for applications. If you don't have internet, call 1-800-MEDICARE, visit a pharmacy, or go to a library for help. The table below summarizes your options. Use it to take action and lower your costs today. Quick reference guide. Option. Who qualifies? Key benefit. How to start. Generics/substitutes. Anyone. Save 50 to 85% with generics or alternative drugs. Ask your doctor/pharmacist. PAPS. Low income, uninsured/underinsured. Free/low-cost specialty drugs. Visit NeedyMeds.org, RxAssist.org, check updates. Discount cards. Anyone. Up to 80% off at pharmacies. Use GoodRx.com, SingleCare.com, verify prices. Government programs. Low income, Medicare/Medicaid, veterans. Reduced premiums or $5 to $11 prescriptions. Apply at Medicare.gov, Medicaid.gov, VA.gov, confirm eligibility.